and this is Dee, and right now Dee presents today with some signs of aging around her eyes. She also has a little bit of loss of fullness around the cheeks, and some early lines right around the creases of the mouth, leading down in this way as well. And one of the things that we've been talking about is an upper blepharoplasty. And so what an upper blepharoplasty would do would be to make an incision right along this crease line. If you open your eyes just for a second, and you see everybody has a natural crease there, go ahead and relax a little bit. And this incision here would be made up in this area, and then the amount of redundant tissue is also demarcated, and so that the amount of skin to be removed is what's between my pointer here. And the incision that would be seen after surgery would be an incision right into the crease, extending out to about right here. And all of this redundant tissue would be removed. The fat injection would deal with a different type of aging, in which she's lost some of the volume of her cheeks. The fatty tissue normally goes away with age. And so what we do is we take fat, transfer it from the abdomen and into the middle aspect of the cheek so that we can recreate the apple of the cheek that she used to have when she was young. And that makes a significant difference. You can see by recreating this fullness, it lifts up on a little bit of the crease here and gives you more of a softer look. The fat injection can also be applied to the hollowing out underneath the cheekbone here too to soften this appearance. And we all have loss of fat in our cheeks as we age, and that's both in the deep tissue as well as the superficial, and the fat transfer mostly replaces the more superficial fat loss. Fat injections can also be done into the crease here to soften this area and give a more uniform demarcation between the fullness of the cheek and the upper lip. It can be done into the lips, into the downward tilt of the mouth here as well, and it also gives you a very soft, natural look.
Here we are, right before the surgery, a little nervous but excited.
What are you looking forward to?
Just getting it over and the results. Can't wait to see the results. So.
Tell me, what are you having done today that you're aware of?
I'm having an upper eye lift and a fat injection in my face.
And what is that going to do?
It's going to stretch my skin just a little bit, give it a more youthful look, fill in these hollow areas of my cheekbones, and also fill in some of the hollow areas around my eyes. And the crease in my forehead and the bead marks will go away.
Surgery. After I draw on your skin, I'm going to show you exactly where all your incisions are going to be. I'll take you back to the operating room, and Dr. Krzyzek will give you some relaxation medication. The next thing you know, you'll be in the recovery room. You're going to have some ice over your eyes, and when you're in the recovery room, I'm going to gently remove those and let you look around so that you're not startled when you wake up. And we'll put the ice back on, and you need to keep the ice on for about 48 hours after surgery. Obviously, if you doze off and it falls off, that's fine, but try to keep the ice as much as you can because that will reduce swelling and help you with some of the hastening of the postoperative course.
Okay.
Expect to have some bruising because I don't use any type of preventative medication for the tummy for bruising, so you will have some bruising there. And the bruising around your face should be pretty minimal, okay? You need to definitely call me if you have any questions or concerns after surgery, but just expect to get swollen and, hopefully that swelling will reduce quickly.
Okay.
Okay? Okay, so we are going to be injecting some fat into the creases on the side of your cheeks called the nasolabial folds, into the downward tilt of the mouth as well into the round part of your cheeks that have lost their volume due to loss of fat. And so those are the areas we're going to give more pronounced fat injection to, softening and feathering around the lateral contour of this, doing the excision of the extra eyelid skin. Close your eyes for a second. Using the incision at the superior part of the crease here, removing this section of skin above it, as well as some of the fatty tissue immediately. The staff that I work with is very experienced with plastic surgery. Most of the staff that I've been working with I've known for 15 years in this center. Dr. Krusek, our anesthesiologist, is an excellent anesthesiologist. He's one of the best that I know. He is double board certified in both pain management as well as anesthesia, and you'll be in very good hands. Okay, so you'll be meeting him in just a few minutes. Let me get one more mark here. Symmetry there. Okay. Did you have any questions for me before we go back?
I think so.
Okay, very good.
My name is Dr. Michael Krusek. I'm an anesthesiologist. I work with Dr. Elizabeth Harris and have been for approximately 15 years. We've been together on multiple procedures. And I was born and raised here in San Antonio, went to University of Texas at Austin, then over to Houston for medical school, and then back here at the University Hospital for anesthesia training, and have been in practice here for, hate to say it, but about 30 years. But it's been a joy and it's a privilege to work with Dr. Harris. She's one of the finest surgeons I've ever met. So anybody that has her as their surgeon's in good shape. I'm going to go into the operating room, going to give you the medication. It's very nice. You'll fall right off to sleep. You'll be completely asleep for the procedure. You're not going to wake up during surgery. Have a nice nap, okay? I'll be right there with you the whole time. When we're done, we go right around the corner over here to recovery room. You'll be waking there just a few minutes after we're through. I will give you several medications to help prevent nausea, so hopefully that won't be a problem, and a couple of really good pain medications. So as you're waking up, you'll be nice and comfortable, okay? So we're going to take real good care of you today.
Okay, great.
All right? The other thing that I need to tell you about is once you're asleep, I will be putting a little breathing tube in. You won't feel it. It's going to come out before you wake up. But you might have a little minor sore throat. You might have a scratchy throat. If you do, that'll be gone by tomorrow morning.
Okay.
Okay? All right. Are there any questions I can answer for you?
No.
You did great. We'll take good care of you today, okay?
Okay, great.